We've got gynecologist and women's health expert, Dr. Jessica Shepard, joining us today to talk about new concerns and truths about trends that you may be seeing online. Dr. Shepard, I'm so glad that you are on with us. And totally as an aside, I am such a fan. That's why I started following you on Instagram. I think you are fabulous, honey. So glad we're talking to you today. Okay, so the FDA plans to investigate potential harm to women from heavy metals like lead and arsenic found in tampons. This is hugely concerning. Why would those things even be in tampons?
You know, that was initially the question that I had, but when you actually look at products that are made, it is not uncommon for them to have very trace amounts of metals when you think of manufacturing. Now, because of the study that was done that did look at all the metals, and I think they looked at about 16, they did find that there were probably more than they expected. But this is what the type of research that we need, because this can then lead to, is it something that could now go into the tissue in the vaginal area? And this is where it's concerning, because it can be systemic. And so, again, it's not uncommon to find these things in products. It's more of the amount and does it get through the tissue of where it is and being absorbed. So that's what we're going to have to find out in future research.
It's all just fascinating. You just explained it so well. But yes, that future research is absolutely needed. Okay, Dr. Shepard, cortisol face. I'd never heard of this before, but it apparently is trending on TikTok, and we know that that is not an actual medical term. What should people know about cortisol?
Well, let's start out with exactly what you just said, that it is not a medical term. This is one of these TikTok trends and phenomenons. And really where they got it from is that it is more of a circular kind of swelling appearance of someone's face. Now, the reason that this is not an actual definition is because it has to do with cortisol, which is our stress hormone, which when it is increased due to stress, there is a feature that is called moon phase that we use in medicine when you have too much cortisol. And that's what can lead to what we call Cushing syndrome, which is very rare, but that's where you start to see that moon phases that we use as a term in actual medicine. So it is not a medical diagnosis or term, but it does refer to kind of that cheek swelling, which is different to moon phases with Cushing's disease.
Okay, this is very interesting. And so is this next one. Mouth taping at night. This is also a trend that's circulating on social media. People say that it can reduce dry mouth, prevent snoring, which sounds appealing, but they also say it can help your jawline, and that's what got my attention.
That's what got your attention, right?
Yes.
Okay. So first and foremost, let's knock that one out. It is not going to make your jaw snatched.
Okay.
But mouth taping is exactly what it sounds like, the idea of taping your mouth closed while you're sleeping. And the reason that this became a trend, rather, is because nose breathing is best when we think of sleeping because of the fine hairs that are in our nose that kind of push away any bacteria or allergens. But mouth breathing is usually going to be associated with things such as sleep apnea, which can then lead to heart disease or lung disease. So it can kind of like catapult into these other diseases. And it's kind of a trigger for us as physicians to being like, well, why are you mouth sleeping so much? So the important thing to know is that if you want to try it, I mean, I'm not going to tell you not to try it, but we're really looking for, from a medical perspective, is there a benefit? So there's really limited studies on mouth taping, and there's really conflicting results. The most important thing I would say from this is make sure you find the root cause of why you're mouth breathing and snoring, because it can be a bigger problem than you suspect.
This is very interesting, and I'll ask you offline about me taping my husband's mouth shut at night. Dr. Shepard, thank you so much for being here with us today.
Thanks,
Appreciate
Renee.
you.